Welcome back to another live Facebook Live with Plastic Surgeons of Lexington. I'm Dr. Michael Lynch, here to talk to you today about breast augmentation, how I do it, your options, and then most importantly, we're running a special right now on it because this is the time of the year to get beach ready. So kind of the first thing I get into when I discuss a breast augmentation are kind of what the patient's their goals are, and that comes into, are you looking to improve your shape, size of your breasts, both? And those are all things that can be accomplished with an implant. There are both different types of implants, silicone versus saline. Majority of our practice, we use silicone implants mainly because I think that they give a more natural shape and feel compared to a saline implant. And there's all different types of shapes and sizes, so you can kind of look here and see different implants in terms of projection and volume. Obviously, are some of the issues you decide upon. I think our approach here is really unique in the fact that we empower the patient with the sizing system. So therefore, our patients put on a sports bra and a gel sizer, and they kind of determine based upon our preoperative measurements as to how large or where they want to go, and still with a very good natural aesthetic result. I think that there's other discussions we always have with a patient as to where to place the implant. Majority of the time it's under the muscle, and that's due to just upper pole coverage of the implant to protect it from you seeing rippling. It also decreases one of the big complications in this operation, which is capsular contracture. So those are all things that are made better by placing it under the muscle. It also makes the, in my opinion, the implant and augmentation look more natural. Breast augmentation is a great way for my patients to come in and feel better about themselves in terms of how they fit their clothing, how they fit their swimsuits. And so that's why we usually offer a special this time of year, because it takes a little while after your augmentation before you're able to kind of wear certain clothing. And so if you want to get ready for the beach or the pool, it's better to kind of go this time of the year, because by the time that's here, you're already ready. Recovery time is somewhere in the ballpark of a month to 6 weeks. You're back to what you were doing. The operation doesn't take too long to do. It's outpatient, and I think that overall the majority of patients are extremely satisfied with their results, and that's due to just our technique, but then also how we pick our implants and that. So I will just show a few examples of a realistic approach here. This is a before and after picture of a patient that you can see the difference in size and shape. Our goal obviously is to get medial cleavage with your implants, so you want to get the implants as close as you can possibly go to give more shape and volume, but this is a nice result in terms of how much more full this patient's breasts are, and you can see from a side view as well much more projection that the implant allows for this patient. Another example, similar, same kind of thing, you can see much better volume, much better shape, still a natural appearance to the breast. And that's your goal here, is to kind of get more full and be able to fill your clothes out better.
We just had some people join. Can you explain what material you use again?
So this is a silicone breast implant. My partner, like I said, we're 90+% of the time silicone breast implants, and that's just due to the fact of how much softer they are, how much better they hold their shape, and how much more natural appearing and feel they have compared to a saline breast implant. The one thing I think that's really unique about silicone breast implants nowadays compared to where people in the past worried about them in terms of leaking. So what's changed is these implants now, about 2 years ago, give or take, came out with what's referred to as a 5th generation of silicone breast implants. And what changed is this is now a gel-filled implant. It's no longer liquid silicone. So you can actually chop this implant in half. I've done it, squeeze on it, and it goes right back into its shell. It doesn't leak. So the safety profile is going up. And so that's really the big thing that allowed us to say, hey, listen, the best implant by far, in my opinion, is a silicone breast implant. And now the safety is equivocal to a saline implant, so you don't have to worry about silicone leaking like they did in the 80s and 90s. So that's really kind of changed for us, and I think that's why the majority of us use silicone breast implants. I'll also go into the fact that since we do such high volume of breast surgery here, our implant prices you can't beat them. And so therefore, I never wanted a patient to have to choose an implant based upon cost. And in the past, there was a pretty wide discrepancy between the cost of a saline implant to a silicone implant, but now because we do such great volume here, we get implants at a very good price, and we pass the price right on to the patient, and therefore there's not really a financial difference between the two implants. And so therefore patients are choosing the correct implant, the better implant, but not based upon price.
You got a good afternoon from Florida.
All right. Probably my brother out there watching me.
And Amy White says, you all are amazing.
All right. Well, I appreciate that, Amy. Thank you. And my brother, thank you for watching. One of them, at least.
Someone wants to know, how long do they last?
So that's a good question. So I think the fallacy that's out there is people always say, hey, every 10 years you got to replace your implants. That's not true. Implants were said to be that way because the company would give a warranty based upon 10 years. It does not mean that you need to change your implants out in 10 years. And now to show you how much more companies believe in their silicone, not causing problems, etc., implant warranties are now 20 years. And so for 20 years, implants are covered for capsular contracture issues, for leakage, things like that. So that's the company saying, hey, listen, we think our implants are much better than they used to be. We're going to stand behind for an extra 10 years. Now it's 20 years. But there are people that have implants for 30 plus years. And if you're not having a problem with them, there's no reason to go in looking to replace them. I don't believe in that plan. I think that as long as you're having no issues, you can have your implants as long as you're doing well with them. I think that what the teaching is sometime now, we think somewhere in the ballpark of maybe 25 years or so, the shell starts to kind of weaken, and that's when you can say, well, maybe the implant's not completely intact. But again, if you're not having problems, there's no reason to go looking. And so that's what's changed with this new gummy bear type implant, the gel implant, that you wouldn't know this implant's leaking unless you got an MRI. It doesn't change its shape, it doesn't change its form, and so therefore, if you're not having problems, there's no reason to go looking. So, I think a breast augmentation is a dynamic operation. I love doing it. My partners love doing it. So I think it's one of those things that we enjoy doing it here. I think we do a great job. And I think it really, more importantly, really gives patients self-confidence that for years have been lacking and wanted to, like I said, fill out their clothing better. This is a great operation for it with very minimal downtime and long-lasting, repeatable results. So thank you for tuning in, and we'll be back soon.